Have you ever received your blood test report and felt confused by terms like WBC, RBC, hemoglobin, or platelets? You're not alone. The complete blood count, also known as the CBC test, is one of the most commonly ordered blood tests in the world. Yet most people never truly understand what their results mean. In this video, I will explain CBC test results clearly and scientifically, including normal ranges and what high or low values may indicate, so you can better understand your health and discuss your reports confidently with your doctor. Let's begin. The complete blood count is a laboratory test that evaluates the three major components of your blood: white blood cells, red blood cells, and platelets. Doctors commonly order a CBC test to detect infections, diagnose anemia, monitor chronic diseases, and evaluate symptoms like fatigue, fever, weakness, or unexplained bleeding. First, let's talk about white blood cells. White blood cells are a key part of your immune system. They protect your body against infections, inflammation, and foreign invaders. The normal white blood cell count ranges from 4,000 to 11,000 cells per microliter of blood. A high white blood cell count may indicate a bacterial or viral infection, inflammation, physical or emotional stress, steroid use, or, in rare cases, bone marrow disorders. A low white blood cell count may be seen in viral infections, vitamin B12 or folate deficiency, autoimmune diseases, or as a side effect of certain medications or chemotherapy. The CBC test also includes a white blood cell differential, which shows different types of white blood cells. Neutrophils usually increase in bacterial infections. Lymphocytes often rise in viral infections. Eosinophils are linked to allergies and parasitic infections. Monocytes help clean up dead cells, and basophils play a role in inflammation. Doctors use these patterns to narrow down the possible cause of illness. Next, let's discuss red blood cells. Red blood cells carry oxygen from your lungs to the rest of your body. A low red blood cell count can lead to anemia, while a high count may be seen in dehydration or certain lung conditions. Normal red blood cell counts are approximately 4.5 to 5.9 million in men and 4.1 to 5.1 million in women. Hemoglobin is the protein inside red blood cells that carries oxygen. Normal hemoglobin levels range from 13.5 to 17.5 grams per deciliter in men and 12 to 15.5 grams per deciliter in women. Low hemoglobin levels may cause fatigue, weakness, dizziness, shortness of breath, and pale skin. Common causes include iron deficiency, blood loss, chronic disease, or nutritional deficiencies. High hemoglobin levels may be seen in smokers or people living at high altitudes. Hematocrit represents the percentage of blood made up of red blood cells. Low hematocrit supports a diagnosis of anemia, while high levels may suggest dehydration or polycythemia. Now let's look at red blood cell indices. Mean corpuscular volume, or MCV, tells us the size of red blood cells. Low MCV is commonly seen in iron deficiency anemia. High MCV may indicate vitamin B12 or folate deficiency. Mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration, known as MCH and MCHC, measure how much hemoglobin is present inside red blood cells. These values help doctors identify the type and cause of anemia. Now let's move on to platelets. Platelets are responsible for blood clotting and preventing excessive bleeding. The normal platelet count ranges from 150,000 to 450,000 per microliter. Low platelet levels may cause easy bruising, nosebleeds, or prolonged bleeding, and can be due to viral infections, autoimmune disorders, or certain medications. High platelet levels may be associated with inflammation, iron deficiency, or bone marrow conditions. It's important to understand that one abnormal CBC value does not automatically mean you have a serious disease. Doctors always interpret CBC results together with your symptoms, medical history, and other laboratory tests. Never self-diagnose based on lab reports alone. Always consult a qualified healthcare professional for proper evaluation. Now you can read and understand your CBC test results with much more confidence. If this explanation helped you, like this video, subscribe to the channel for more medical topics explained clearly. Thanks for watching and stay healthy.